All right, y'all, I guess we're gonna get ready and start. So my name's Trish Bueller. I'm one of the assistant nurse managers here at TMH for the family care or mother-baby unit, as you can see here. So we're gonna just kind of go through, introduce ourselves and go through a little bit of spiel, and we're gonna do some questions and answers afterwards, okay? So congratulations, glad to have you all here.
All right, I'm Kathy McKeon. I'm a nurse midwife with the Family Medicine Residency Program, and we also provide triage care. So you might see me in the triage area, or ED, OB-ED now. And I've been here since 2005.
Good afternoon, my name is Keisha Jenkins. I'm the Doula Program Coordinator for Capital Area Healthy Start.
Cool. My name's Amy Kimmel, and I'm one of the staff nurses in the family care unit. I've been doing that for almost 2 years and working in mom and baby space for a little over a decade, working as a doula and childbirth educator. So I've got lots of postpartum experience. The nurse role has a little bit different perspective, and I kind of wanted to start there, sharing with you guys what to expect from your nurses, because we're the people you see a lot of when you come up to us. So what you can expect when you've just delivered your baby is that your recovery in the immediate postpartum for the first hour or two is hanging out in labor and delivery, bonding with baby. And that time is really precious and important, that it's uninterrupted. So our goal is to get that to be as much skin to skin, time breastfeeding, focused on that. During that time, there'll be a flurry of activity with your nurses from labor and delivery, hanging out to make sure that you're good, baby's good, all your vitals are good, and you're not having any immediate emergencies. If you're not having an emergency, you guys should be hanging out skin to skin. And then once you're settled and stable, they'll get you cleaned up and bring you up to see us. And so we'll take over from there. There's a little period of frequent checks where we're coming and mashing on your belly, doing what's called a fundal check or fundal massage. Very misnamed because it's not a hot stone massage, quite uncomfortable. And of course for that we've got medications and heat packs and all sorts of things. But that part is uncomfortable and also really important. My goal as your nurse during that time is to make sure that your bleeding is normal, because one major complication is an emergency known as a postpartum hemorrhage, and we are making sure that doesn't happen. If it does, we have all the protocol, all the friends that we need on unit to come and help with that swiftly. So that's our immediate concerns. We're also checking baby, make sure that they're transitioning well, because they're brand new to planet Earth, and out here where we have this oxygen, they've got to figure out how to breathe, and that's all brand new to them. So we're getting all that settled. We know that you're very tired when you come up to us. Probably for all of your labor and delivery experience, you've been sleep deprived, potentially also very hungry, and we want to get you some rest. But that initial period is a critical one to make sure that you're safe. So we're the guardian of your safety during that time. After we're done with those frequent checks, then we are going to try and clear out as much as we can and stay out of your room unless you need us. And you might need us for things like pain, for assessing baby or helping baby to feed. And my favorite #1 nursing tool, besides my beautiful brain, is the sign I can put on your door that says to call me before you walk in that room, because I know you're asleep and your visitor or the birth records folks or the photographer, whoever wants to come in your room, can check with me, and I can say, no, she plans on taking a rest between 10 and noon, and she'll get up for lunch. We can all go in there at that time. So if you coordinate with your postpartum nurse of letting us know just when you plan on resting, or hey, I'm gonna take a shower and then I'm gonna nap, then I can get all the stuff done before you hit the shower so that I don't have to come bother you again while you're just about to fall asleep. That's the worst one, just about. So coordinating with us is a huge, huge deal. The other thing I love for people to know about getting rest when they're on our unit is that we welcome your visitors. They are a wonderful asset to the team of supporting you if they are also on board with the goal of getting you sleep. if they want to come hear about how the baby was born and all the stats and figures of how long he is and how much he weighs and do you think he has mom's eyes or dad's eyes, great convo for when you're well rested. But in that immediate time, the first day, you're very, very tired, and if those folks want to come chat with you, they might be on my naughty list. So I would love for those people to come with food, to come with helping hands where they can come and bring you clothes, help you get dressed and showered, all the things that you might need if you're needing some extra support. Otherwise, it might be a good idea to just send them to see you when you're at home rather than while you're in the hospital, because you're needing so much time to recover for that. We do welcome visitors, but do keep in mind our rooms upstairs in family care are small. I like to call them a matchbox room because there's enough room for all of the important, pieces of mom, dad, baby, and me, but not much else. So just do keep in mind you can host a limited number of people for a limited amount of time comfortably. It gets crowded really quick where you're like, okay, ready for you guys to go. If you ever need help getting people to leave, even though we have very generous visiting hours and we're pretty unlikely to make people leave at a specific time, if you ever need help getting people to go, because it's like awkward to say to your mother-in-law, like, go away, I am tired of you, then let your nurse know. We can always help with that because we can come up with some reason that it's not at all on you, and it's all on us because they can hate us. They don't have to see us at Thanksgiving dinner. But that's like our immediate concerns. After that, we're really trying to educate you once you're well rested to make sure that you go home knowing what's going on. So one of the things that we passed out is the education booklet that you get for preparing to discharge. And you are getting that right when you come to our room, very first moment. It's got lots of important information in it, and we don't expect you to read it cover to cover when you've just freshly delivered. So it's kind of nice that you have it now and you can read ahead and come extra prepared. And then, of course, we can step you through all of the things that are particularly important. So that gives a great launch point. Now, I will brag on this book because I've seen lots of different educational books over my years. This book is extremely up to date. There's not a single thing in there that is inaccurate. I do have one picture I wish they'd switch out, but everything else, informationally wise, is lovely. And it does have an app, which sounds kind of like they're just trying to be hip and cool to have this QR code app thing, but the links to the videos that it takes you to are just on the QR code. The videos are high quality, great information, and especially good if the idea of sitting and reading this book just bores you to tears. Watch the video. They're short and sweet, give you good info. And then when we send you home, we're sending that education with you so that you can be empowered in having a good postpartum experience, knowing what supports are available to you, making sure that your support people who are there are also trained in how to take care of you and the baby, because this is not a solitary effort. It's a team effort, and it definitely is something you're going to need some guidance on. One of the things that I'll point out in that book is the very last page goes over the maternal warning signs on one page, and that is got a little perforated cutout line. I wish it were tear out, but you'll have to use some scissors. That page is an excellent thing to keep on your fridge so that if anything is abnormal with you or with baby, then you know what's going on and you know that it's abnormal. So partners, if she's complaining about having a persistent headache, dizziness, blurred vision, her swelling is suddenly way worse, or if she's passing lots of clots, filling up pads frequently, those are all warning signs that we would want to see back in the OBED, our new title, the obstetric emergency department. So coming back to triage. We do sometimes on the postpartum unit get people who come back for these emergencies, and it's because they knew what the signs were and came back when there was something really concerning. One of the things people frequently don't know is a postpartum complication that can arise is postpartum preeclampsia, which typically doesn't show up while you're here initially. It shows up once you've gone home. Kind of a hot spot for that to show up is in the first week or two. And so if you go home and you have symptoms of hypertension like that, blurred vision, dizziness, headache, swelling, or chest pain, it's kind of a late sign, then those things would definitely be a reason to be concerned We used to think that once you deliver the placenta, that preeclampsia is now cured and you don't have it anymore. But now we know that there are different time frames and different ways it can show up. So it's very important that people know what those signs are and take it seriously. We as women tend to dismiss our own concerns pretty easily. So if you hear her complaining about those things, you just give her a little nudge. And along with this discharge education booklet, we also have a discharge packet that Trish will tell us a little bit more about that kind of coincides with it.
Hi, y'all. All right. So I'm not one to kind of stand still, so I move around, so I'm sorry. It's 5 kids and 6 grandkids, so you'll see me sway a little bit. and we sway a little bit because we're on the postpartum unit, and we kind of, when moms and dads really need to have an hour break, we don't have a full-time nursery, so us nurses kind of tend to help babysit a little bit. So sorry if I sway too much. So we handed out 3 pieces of paper, okay? Mamas, when you are with us and you are discharged, you're actually going to get a green folder. Green means go. So what does that mean? You're actually cleared at that point to go ahead and leave our unit. All right. When we give you this green folder, we're going to go over everything that's here. One of the papers, the first one, it says post-birth health check. Okay. Moms can't take care of themselves. They can't take care of baby. They can't take care of the family, correct? So we used to focus on, you have this baby, we take care of mom first because you're baking that little one, right? You have that little one, you come up over here, we used to teach you nothing but how to take care of that baby. Baby 101, basically what it was, alrighty? We kind of forgot about mom. Well, this last year, statewide initiative came in place, and we have started it here at TMH. We now trying to make sure that we focus back on our moms, right? We don't want to forget them. So instead of a 6 weeks postpartum appointment, you guys now get a 2-week postpartum appointment. Babies go home and they get seen in one to 2 days. We want to make sure they're doing okay, they're breathing. There's not any respiratory issues. Their jaundice levels are good. Well, what about mom? Okay, 6 weeks is a long time to go, and you forgot in 6 weeks what happened in week 2 or week 1. You know, something cropped up. Well, guess what? That's not happening anymore. We're actually finding that all those issues that moms were having in the first 2 weeks, you're now being seen at that 2-week appointment, so they're now getting addressed a lot quicker, all right, which is a great thing. Moms are much more happier, especially with those postpartum blues being caught. Alrighty, and we're going to go into more that information in a little bit. But that's some information for here. The other handout we've got you is called the B's. It's nothing, as you can read down, it's all starting with the B. All right, I'm old, so I have to put the glasses on to read it for you. All right, so the first 2, blues and bonding. Alrighty, we definitely bring in your significant other and any family members there when we educate you on this. Because guess what, Mom, your hormones are going like this, a roller coaster. You don't know if you're coming or you're going. You're sleep deprived. Alrighty, you're having to be up in the middle of the night, trying to latch baby. You're exhausted. You're just like hit your brick wall. You're like, wait a minute, okay? When you go home, we can't go with you. All right, while you're at the hospital, we're your support team also, but we can't go home with you. So we teach dads and family members what to look for, because they're going to be your first line of defense to help catch any of these issues with postpartum depression, the baby blues. The next thing we're talking about is breast or bottle. All righty, baby has to get fed. Personally, I just need baby fed. I'm going to help you either way. If you decide to breastfeed, we're going to work with latching, we're going to work with positioning, we're going to make sure that that little one's doing really well before you go home. If you're bottle feeding, we're going to teach you how to bottle feed. All righty. Olden days, I know I was guilty of it. 5 kids, my oldest is 30. Here's a bottle, let them chug the whole bottle. Well, guess what? 5 minutes later, I used to wear it. That was not, regurgitated formula is horrible. So we teach you what we call paced feeding, alrighty? A little bit out of a time, burp them. Guess what? Majority of the time, your babies are not spitting up on you, which is great. Bleeding in bottom, Okay, those are really important. We want to make sure that there's no issues down there. Your bleeding's doing well. Your fundus is nice and clamped down. As Amy said, we're going to rub on your tummy. Okay, the great part is once you're discharged, we don't rub on your tummy no more. So we're not the evil people for that one. Baby spacing. Who here is raise your hands if this is your first baby. Oh, wow, awesome. Wow. All right, second babies, third babies, all first timers. Great, awesome for y'all. All right, does anyone know here why you have the oops babies, those Irish twins, and like, why did I get pregnant? No takers? Guess what, moms? You ovulate before you have your period. So our oops babies are, hello, oops. Why, I didn't have a period, so I shouldn't be pregnant. Oh, we ovulate beforehand. So we're gonna teach you that, and we're gonna talk about baby spacing, because if you're like some people I know, 10 months down the road, here's your other baby coming. You're already dealing with one, short sleep, whatnot, already in diapers. Now you're adding a newborn in diapers and less sleep and all that. Not cool. So, and the other thing is we want to make sure that your body has a rest, all righty? The best thing is 18 months between children. And that's the optimum, because we want, again, your body to make sure you sustain another pregnancy, have no complications.
Minimum.
We're
not saying you're required to come back. Yep. It's not a subscription 18 months later.
That's it, minimum. Blood pressures. So that's a big one. Not only have I been a nurse for 17 years, but I've been a paramedic for 26 years. I did not know anything about the correlation. Sorry, I haven't had coffee this morning, y'all. Bear with me.
I had enough for us both.
The correlation between blood pressures and having a baby for the first 12 months. Okay? You can have absolutely no risk factors at all and still have blood pressure issues up to 1 year after you've had your baby. Okay? If you have blood pressures issues, they're through the roof, they're abnormal, high, guess what? You're open to having not only heart attacks but strokes. Okay? I went to a mid-initiative conference this past year in November, and this mama was talking and giving her presentation. Absolutely no risk factors whatsoever. Okay, she went home, discharged the first day, had a headache. Her husband was a paramedic of 20 plus years on top of it down in Orlando, and he didn't think anything of it. Mom laid down for a little bit, popped some ibuprofen or Tylenol, and she got up, headache was worse. Again, they didn't think anything of it. She went down, laid back down, got up, she started having slurring speech. They took her to the hospital. She was in the hospital for 40-something days afterwards because of major severe complications with her blood pressure alone. So we want to teach you what to look for. We're going to teach you how to take a blood pressure, especially if you already have some predefined risk factors, okay? But we will also want you to be aware that your blood pressure can be kind of wonky up to that first year. So it's really important with that one. And then, again, we're going to talk to you and send you home some information with birth control information, all righty? If you decide to start birth control, you can start it here in the hospital at discharge with us. So our providers will do LARC, a long-acting implantable device that can come out several years afterwards. So this way you don't even have to worry about it. We can do the depot shots also at discharge, birth control pills. There's a lot of options here, all right? So this way you don't kind of get that several months down the road and hello, oops. Oh, honey, Christmas time we're having two. So I know, my house is like that, so. Anyway, I'm going to turn it on over to you ladies.
All right.
So you can elaborate more than me.
So I'm going to be talking about those postpartum visits she mentioned. We try to get one between 2 and 4, so soon after delivery, and then between 8 and 12. So it gives you some leeway there. The first visit, we're mostly looking, we're going to check your vital signs, check for any problems, and check your mood. We generally don't do anything invasive. And it's usually if everything's okay, it's a pretty quick visit. Then the 6 to 8 week postpartum is a more thorough Do a little pelvic exam, check your vitals, see how you're doing again with mood, and address, again, if you haven't decided on birth control when you left the hospital, we'll address that at the 2 weeks and the second visit. Most insurances now cover postpartum visits up to 12 weeks. The hospital, the OBED, will see you in triage, or OBED, up to 12 weeks for anything postpartum related, all right? So that's what, if you have any of those issues, don't go to a doc in the box, come to OB triage, because we see you in the field of postpartum, where some of those outlying ED, they might see some blood pressures, give you some blood pressure medicine and send you on your way, whereas we do a little more thorough investigation into that.
Do you mind if I interject something there? So I won't bore you with all the details of it, but I know of somebody who works in the ER and recently had an issue where mom had come in and had a delivery but didn't specifically disclose that when the assessment was initially done during triage. And so they weren't thinking of all the complications that are associated with a delivery. It just didn't come up. It only came up later when the partner had arrived with the baby and they put 2 and 2 together, like, this is your newborn who's, you know, whatever age. And so they kind of put it together then and were like, oh, that might be what's going on. And so knowing that if you're past that 12-week point and you do go to your physician, your primary care, or you go to an ER, that you specifically mention within this same year, hey, I had a baby, they're 8 months old, whatever the case may be, because those things can be extremely important when they're initially trying to figure out what is wrong. The different signs and symptoms can be interpreted differently with that background information. Super important to mention. Go ahead.
And I'm going to be very brief about postpartum depression. I don't want to scare any of you into it, but it occurs in 1 out of 7 women. So it's as common as gestational diabetes. So we are going to be screening at both those visits for that. We're not saying anything's wrong, but we do need, it's our obligation to be screening for that. And if you have any issues, you can go to your OB provider first. They can prescribe antidepressants. They can assess postpartum depression. But we also recommend you also see a counselor, a licensed clinical social worker, psychologist, psychiatrist. If there's a more serious mental illness developing, then we would definitely recommend you see a psychiatrist too. If you are on any antidepressants currently in pregnancy, don't stop them. That they used to, all the psych providers, I don't know if it was to cover their butts, would tell anyone pregnant to stop taking them cold turkey, and we have found that that's not a safe thing to do. No. So stay on them. You might need to adjust the dose after, or increase it, and that's something your OB provider can do. All right. What else?
I was going to say, one of the handouts, KK doesn't know I did this, but one of the handouts that's included there is this one. It's gray, front and back. That's for Postpartum Support International, and it talks about perinatal mental health. So we often use the term postpartum depression because most people know it, but perinatal means before, when you're trying to conceive, during pregnancy, and also during postpartum. So it encompasses all of that. And it's not just depression, it's also anxiety, sometimes OCD, and also bipolar can show up occasionally, and very rarely psychosis, which is the one that makes the news. But this one mentions about different ways that you can ask yourself, kind of checking in with yourself. So you can certainly do that, of how you're feeling. And they have specifically listed all of the programs on the back page. So it outlines the different types of disorders, but then the types of treatment options through Postpartum Support International. And that is very easy to remember website, postpartum.net. It's also one of the websites that we include in our PAC information, so it's listed there as well. But postpartum.net is a great way to find resources. One of my favorites is the directory, so that online provider directory listed there, because it has people that are local, So you can hone in on your location in Tallahassee. I check it frequently to see if more people have popped up. I like to be aware of them, introduce myself to them. And so all the people that are currently listed on the directory are people that I know personally, trust. I would go to them. I would send my best friend and my sister to them. So they are excellent, particularly for things that show up for this specific issue. They're great therapists in general, but they're extra trained in maternal care. And so if something shows up during pregnancy, you could definitely reach out then, or if we just are screening and things are showing up either in the hospital or afterwards, then that's a great resource to know about.
So hi, as I said, I am the program coordinator for the Doula program with Capital Area Healthy Start, and we focus a little more on prevention. So we're talking about post, right? But a lot of this is things that you can start to slowly educate yourself on as you're going through your pregnancy. I have 4 children. I've gone through it. I know that right now you're like, oh my God, this is so overwhelming. This is so much information. Oh my gosh. And so that's where the doulas can step in. We also have an umbrella of other programming such as Coast and Team Dad. Coast is new, but it also, if you have any of those high blood pressure, any of those just social determinants of health that are starting to show, we are providing for free blood pressure cuffs. We're providing free scales. And I also have pregnancy navigators that can go out and navigate you through that world on top of the doulas. So a doula, I like to call myself an emotional support animal for pregnant people. That's what I do. That's how I tag myself. I love it. I don't care. So the way I look at it is I offer prenatal services, birth, and post. Prenatal looks like I come in, we talk about your birth plan, talk about everything these ladies talked about. I have all that information. So we go through it before you even get here. We educate you before you get here. With your birth plan, it's not just birth, it's also postpartum. So there in your postpartum, you can say, please put a note on my door and say that I'm sleeping between 10 and 2 and do not come in my room. Or you can leave me with a lovely note, because kind of like you, they don't know me. And I can say, hey, Grandma, it's kind of 2 o'clock. It's time for us to go ahead and exit out this way. I can be that bad guy for you, or I can be that good guy, depending on how you would like for us to look in that area. But during the birth process, we're also there. So the nurses do kind of step back a little bit during the golden hours, I like to call it. Our doulas normally hang out for the golden hour. I normally sit in the corner somewhere just observing you, making sure you're okay, watching baby, making sure your first latch goes well if you decide to breastfeed, or making sure first feed goes well. And if anything tends to come up, I normally have a pretty good relationship with the staff, and I'll say, hey guys, I kind of saw something, because I'm non-medical and I'm not checking anything. Let me go ahead and put that out there. We are non-medical. I will go get these ladies. I am non-medical. If I see something, I just like, hey, you might look at it. I'm not doing that. But I'm just really there to support you and make sure that you have the birth that you want, but also that you're empowered and educated throughout the process of it. During the postpartum period, it could be a lot. As she said, they do a mental health checklist. We do one too. And the reason why is just because 1 in 7. And sometimes you may not know. You may feel like you're perfectly fine and nothing's going on, and it takes someone on the outside to say, hey, you might need to talk to your provider. And that's something that we do provide at Capital Area Healthy Start, as well as with the Coast program. We have on-site mental health as well. So we can also connect you there too. For the dads, we have Team Dad. That is a whole group of dads. It sounds like it, yep. It's a whole group of dads that get together, they hang out, and they get to talk about all this awesome stuff and get to hear my mouth too. So I will come in and say, like, Dad, no, we're not watching football during delivery. You're going to stand here and you're going to help me massage Mom's back. This is how you're going to support Mom through this. Just like the ladies talked about, I'm going to also educate you on the signs, right? Because again, sometimes as moms, we get in that mode. There's so much that's going on with our bodies. We're just trying to survive.
I was going to interject.
Yeah.
Fathers can, or partners can get postpartum depression too.
Sure. Yep.
As high as 1 in 10. So we might not be able to provide the care for the males, but we can definitely seek it out.
Oh, we can screen and we can educate.
Yeah.
I've been there, done that many
and
times.
Team Dad will get you. Like seriously, I mean, we have resources. That's just one in the city that provides resources to dad, but you guys are just as much a part of the birthing experiences as moms. So don't feel like you're left out.
I wanted to mention I had a Team Dad patient not long ago, like didn't even know all the details of it. I was hearing it firsthand from him. His review of that was that it was so empowering, so wonderful. And specifically with this patient, his partner had a hemorrhage, and it was not a fun one. You were with me. Yep. It was not a fun one. It was very scary, but he knew how to step in and support her as she was recovering, and he was an excellent team member for her, the support that they had just watching that happen. Look, I don't know how he was before Team Dad, but I'm just saying that was superb.
I've met some amazing Team Dads.
He loved it, and clearly it was
working.
really beneficial. So excellent program.
So I wanted to interject also and add that we have started partnering within the last 8 months or so, 9 months, with Capital Health Plans Healthy Start. We have a Connect partner here in our hospital that is here that will go around to every single room of our postpartum moms and talk to mom and dad to see how you guys are doing and what can they do to help provide any resources. Again, you know, we're a great resource. This team here is a great resource while you're here, but we can't go home with you. So where's that resource there? You've got your significant other, your partner, you've got your family. How can we build on that to make sure that you have all that support that you need when you go home? Because obviously, you know, you're going to have your moms, dads, grandparents are going to be here, but they're only here for a short time, week, maybe 2. And then they're going to go home because they've got to go back to work or do whatever. So guess what? We want to make sure you have that support system, whether it's mental health, whether it's you need help with a car seat or anything. That's a great time when they come around, talk to them, okay? And you may not need anything at all. However, they can give you a brochure, so when you go home and you're like, man, I do need this, but I should have asked. Oh, wait a minute, I have that brochure. You can grab that brochure and look for all these different phone numbers and connection partners that can help you when you go home. So that's a huge resource that we have here for you.
Yep. No, I'm retired military, and a lot of those families don't have families nearby. They're overseas. Grandma's not going to travel to Germany at the drop of a hat. So that's very important to have those resources and kind of like build your tribe now. So if you don't have all those resources, you have some people you can make a quick phone call to. But the churches have great support groups for moms, community ones. They're out there. But kind of keep that in mind if you don't have those in-laws or mothers to be there.
Or if your in-laws are unhelpful help, as is sometimes the case. Sometimes, and like you were saying with the bottle feeding, sometimes when additional family is present, I'm going over some education because what they used to do when you were a baby is very, very different. Things have even changed since my oldest is 10, and even since when they were born, there are a ton of things that are completely different. And so if you're relying on family members or friends even who have not been, educated, they may not know. So they might be trying to help you and steering you wrong on accident.
And I can attest to that. Five kids. My youngest are 18-year-old twins, and my oldest is 30. I've got 6 grandkids. So they range from just turned a year old, and the oldest is 9. I can say every single delivery for each of my kids and my grandkids, something has changed somewhere along the line. It's just healthcare is ever evolving. We do studies. We figure out what works best. How do we help moms? Have a better outcome. Have a better pregnancy. Have a better postpartum. Have a just better healthy life after you have your baby. Our goal here is to give you all the tools and the support. So when you go home, you guys don't have to worry about a whole lot. You just enjoy that new baby and you have a wonderful time with that little one. Because in a blink of an eye, they're 18 and going off to college, which is where I'm at now.
My oldest is going. I'm having a moment.
I broke down and cried the other day because of that. It's like, where were they this little? Yeah. So we get it. And anytime when you guys are here during your entire visit, from if you're on ACU where you're having to kind of have some meds to stop a pregnancy because little one's not yet ready to come out, we want to bake a little longer, to your time on labor and delivery, to your time here on family care, please let us know if you need something. We're there to support you. Anything that we can do to help make a better stay is our ultimate goal. We're there to support you guys. And dads, don't be afraid to say something. It's overwhelming. Moms having a moment, and baby's crying and doesn't want to stop, and here you are, and mom's saying, you deal with it, I'm going to sleep. And here's dad going, I will never forget this. I had a dad, here he comes, I'm walking in the door, and here's dad holding this like, and I'm like, it's okay, honey, what do you need? What can I do? What do I do with it? Well, let's look. We'll show you how to diaper it, feed it, swaddle it is the big thing. We love doing that.
I love a swaddle.
Yes. Yep.
So jumping off of that, I was going to say my favorite tool I mentioned before is the sign that says, don't go in this room, call the nurse, which is tied to the other favorite tool I have, which is my phone. So on our unit, you can use the call bell, that's great, but the best way to get efficient, effective care of what you need is to call us directly. We will leave the number up on the whiteboard, and if you call us, you can tell us exactly what you need. It shows up when you call based on your room number, so you don't even have to introduce yourself. Poor sleep-deprived parents are trying to remember what room they're in and remember their name. So you don't even have to do that. You just call and go, I need pain meds like yesterday. And they're like, cool, I'm bringing it right now. Can I bring you something to drink with it? Solid. Dad can call and say, mom's having a moment. If you don't call us, we don't know you need something. Yep. And the thing that breaks my heart as a postpartum nurse is when I walk in thinking she was asleep when I popped my head in an hour ago. I walk in and you're like, I'm dying. I need some pain meds, or I couldn't get baby to latch and they've been screaming at me for an hour. I can't know that if you don't tell me. Yep. So just let me know, be willing to be vulnerable. You're gonna practice voicing your requests and your needs and trusting that we are gonna meet those for you when we can. Because if I have it to give, it is yours, okay? Do you guys wanna do some Q&A?
Yeah, sure. Let's do that. Who's got any questions? Oh, come on. Someone's got to raise their hand.
I saw that breath.
Come on.
You thought of one.
It's okay. We won't bite today.
I only nibble. That's what the kids say. Nobody? Oh,
Yay.
good. Yay. We have a winner there.
I was right.
So your unit then will kind of cover hey, I've got to go to the bathroom. I've just, had a lot going on down there. You're going to cover that whole process and everything.
Oh yes.
Yep.
Oh yes.
And actually, I've got several other nurses here that work on our unit. So Jackie and Maria in back. Jackie, wave your hand. So she's our countdown girl. Maria is one of our lactation nurses. Okay, and then Christina's over here is one of our nurses on our unit. Any one of us, when you come up, we're going to go ahead for that first hour. That as soon as you come up, we're going to go over a bunch of stuff with you. Sometimes it's so overwhelming, but the biggest thing is when we're cleaning you up for that first time when you're up with us, we're going to go over all that. We're going to supply you with some maxi pads, those wonderful air fresh
Mesh
Best panties in the world.
Yes.
I will say we just changed our supplier for mesh panties. So if you've heard bad reviews on mesh panties from friends, just know we've got super deluxe, wonderful, and they come in more variety of sizes, which is amazing. I love size inclusivity. And so love, yes. Yes, I used to have to cut a slit and make it a boy short kind of situation for the thick ones.
Those things are best. They're the best thing ever. Do not
great.
purchase that. No. So that's from a doula perspective. Please do not purchase and bring pads and
diapers,
leave all that stuff
adult
in. And diapers, leave all that stuff at home. They have all of that and plenty of it for you.
Now that said, hot tip, the Frida Mama spray Peri bottle is actually worth it.
It is.
Our Peri bottle, which is what you use to rinse off so that you're not wiping in a tender area that's quite sore. The Frida Mama one goes up.
It has an angle.
It's just easier to use. So that one is worth the purchase, but everything else you can just
leave it at home.
stack it at home. We'll send you home with some too, so it'll be good.
You'll go home with more bags than you even came in with, and you're like, how did I acquire this?
I do remember specifically with my youngest baby, somebody offering me an additional pack of pads, and I said, nah, I think I'm good. I should have taken them. We send you home with many, many supplies, and you will use them, I promise.
Take it all.
I'm the doula who's take it all.
Yeah. The other thing I was going to say about that is that it is a perfectly normal part of my job, routine, and I don't think twice about it if I'm helping somebody who has accidentally peed themselves, who has bled all through what they're wearing on the sheets, they've made a blood trail on the floor. Like, those are very normal experiences for me. And I know it's not normal for you, so I understand feeling embarrassed, but just know now, so you can mentally prepare, that if I'm crouched down at the toilet, wiping gently off all the blood that's trickled down your leg, I'm like, yep, this is just a Tuesday.
Yeah.
So
we expect that.
yeah. I'm not flustered by it at all. You had one.
Yes, ma'am.
How soon after birth do you attempt breastfeeding?
Oh, great.
First hour.
Golden hour.
Yeah, golden hour.
The baby's
Golden
alert
hour.
in that hour. They're looking. Things are happening in your body already, getting ready to initiate lactation, and the nurses in labor and delivery will help you with that. We want it quiet in the room. That's where we kind of want visitors to not be in the room. I prefer just to be the mom and the partner and the baby, so it's quiet.
Soon as in our
And if you're bottle feeding, we can initiate. We like to have a couple goes at bottle feeding too. I don't want to say it's just for the breastfeeding
Yeah, no,
moms.
it's for everybody, yeah.
So on our L&D, we do skin to skin. As soon as that baby's born, that baby's skin to skin with mom, okay? And it does a few things. One, it gets that baby to start rooting around and get ready to latch and breastfeed or bottle feed. And it also helps to regulate the little one's temperatures and blood sugars. So for us, as soon as that we start seeing that baby kind of rooting around and kind of, and it's funny because watch, mom, you've got baby on your chest, you'll start to see that baby kind of migrate to that breast and kind of scoot a little bit. And people are like, oh no. I'm telling you that it's
crawl.
they crawl.
They do.
Yeah.
They go right and they'll try to latch on themselves. And that's when us as nurses in lactation, we're going to help you because we want that baby to latch on. So usually really quick within that first hour for sure.
And if for any reason you end up with a C-section, the baby goes with the dad to the recovery room if everything's healthy with the baby, and the dad can do skin to skin.
Sure can.
And if the dad wants, if you guys are planning, or dad, the partner, can initiate bottle feeding if that's the way you want to do it. If not, skin to skin until the mom comes out of recovery, and they can do breastfeeding.
That also tied into one of the other things I want people to know is that all of our nurses in family care are going to be able to help you feed baby and to help if you're struggling. Some people will tell me that they're waiting for the lactation nurse because they've heard we have lactation nurses specifically, like Maria. And we do, and we love to send them to your room. However, they can't be with every single patient for every single feed. We wish we could clone them and make that happen, but we can't. So since we don't live in Utopia Hospital, we're here in the real world. Your primary nurse is going to be the person that you rely on the most. If there's ever a time where they're trying to get baby to feed and they're running into some struggles that are above their level of training or above their ability to assist you, then they're going to reach out to lactation then. Of course, at some point during your stay, you will meet with lactation. They'd come by and check how things are going, assess a feed if they can time it just right, and go over some discharge teaching for you. That's true whether you're breastfeeding or if you're bottle feeding. They'll talk to you about how to care for your breast because bottle feeding moms are still going to experience breast changes and milk production. And so we do have to know kind of how to suppress that lactation. If you're making milk that you don't need, that can be a problem. So we want to make sure that we're helping with that as well. But definitely don't hesitate to start feeding a baby just because lactation isn't right there at your bedside. You can always get your primary nurse to come in and help if you need. And like you said, sometimes the babies just DIY it, so feel free to just latch them if they're ready. But if you need help, then we're there. Again, a phone works great for that. Tell us, hey, I'm trying to latch the baby. What should I do? Can you come help me?
And just to piggyback off of what you're talking about too, TMH has an amazing breastfeeding support group. So when you go home, if you're still struggling or you're kind of having those questions, head up to the breastfeeding support group. Like go upstairs and talk to them and let them know. We do have lactation consultants throughout the community, Kappa area. We have a certified breastfeeding counselor on staff who has connections with, IBCLCs and other those that can help and connect you as well. So remember that even though you're gone home, there are still services that are available up there for you guys.
And outpatient.
And
So in
outpatient,
the
yeah.
group setting is great for general questions and some additional support, especially peer support. But if you have a very specific question that is going to take a little bit more time and attention and assessment, then you can see outpatient. They can either speak to you on the phone if it's something that they can just talk you through. And if it's something they need to see hands-on, they have an office or it's a patient room that's their office. That is dedicated space for an actual in-person meeting postpartum. So you can come back. Typically that's scheduled with the lactation nurse that you saw while you were there. So if you're working with, let's say, Angela, and then you come back to see lactation, she's gonna schedule that with her. If you're there seeing Maria, then you can say, hey, I was there, I saw Maria, and they'll coordinate that. So we've got lots of people. We also have lactation overnight, which is new as of this past year, which was a very big struggle because a lot of babies are awake all night long trying to feed, and if you don't have that additional layer of support, it can be frustrating and disheartening. So it's not every day of the week, wish we had more, but we have many nights and overnight lactation as well.
One of the things our nurses, like Amy had said, all our nurses are trained to help assist moms to latch and help position and kind of make sure that you've got a good latch and you're breastfeeding well. Because when you go home, there's nobody there to kind of monitor that. So as a resource, use our nurses here. Every nurse here on our family care floor should be watching you and assisting you at a minimum of 2 feeds in their 12-hour shift. Okay, so that means you've got, in your 24-hour period, you've got 2 nurses taking care of you. So that's 4 times that a nurse is literally watching you, assisting you, and making sure that everything's okay. Because when you go home, if you don't have that support here, when you go home and you start having breast issues, baby's not latching well, baby doesn't come back to us if there's issues or significant weight loss, that baby's gonna get admitted to the pediatric unit where there's sick kids over there, okay? Ours is a nice, healthy unit. You just had some babies, okay? There's no real sick people up there. So use your nurses, make sure if you are having a feeding, call out, like Amy says. Call them on their phone and say, hey, I'm fixing to go ahead and change little one and then latch. Can you come in and help me? Maybe a few minutes before they can get on in, but they'll come on in and they're gonna help assist you with latching and watching and monitoring you. This way, when you go home, I mean, your latches should be perfect with that. So this way, poor Maria is just going to be sitting around doing, well, I don't have any phone calls. So that's a resource.
And add skin to skin is like the pixie dust of breastfeeding.
Yes.
Yeah.
Yep.
That's going to be
Sprinkle,
one.
sprinkle.
If you have struggles breastfeeding, put the baby skin to skin. That's kind of prepping the baby to breastfeeding skills. And yeah, just want to drop that.
Thanks, Maria.
So my question was more for the programs, I guess the PSI stuff. 9 weeks postpartum at this point for me, but is this just for pre? I think I missed it when you said that. Was it up to like a certain point?
Yeah, what I was saying about the timing. Perinatal is like the term that includes conception, pregnancy, postpartum. The Postpartum Support International doesn't have a cutoff for the time. There are different schools of thought on what is included in postpartum. Medically, there's a lot of milestones throughout there, but what we understand in the psych community in regards to postpartum depression is that during the first year you are more at risk for a mental illness, either depression, anxiety, postpartum, OCD, or psychosis. So that first year is really where they focus, but if you're past that, they're not gonna be like, too bad, so sad. I personally got connected with Postpartum Support International and I was 2 years postpartum from my second baby and had been depressed during the pregnancy prior, so I'd been 5 years of depression.